In this video, we will discuss how to build psychiatry codes using the MDBilling.ca software. If you're new to OHIP billing, this video tutorial will provide you a good overview of the most common billing scenarios in psychiatry. For further understanding of OHIP billing, we kindly suggest that you familiarize yourself with the OHIP Schedule of Benefits. Starting with section A111 and review all the appropriate psychiatry service codes and eligibility considerations. The first visit with a patient is usually a consultation or general assessment A195 after the patient has been referred from another physician. The referring physician billing number must be added on the claim. There's a maximum of 1 consultation per 12-month period. When you see a patient and the consultation is longer than 75 minutes, you can bill special consultation A190 at a higher fee. There are some other codes you may want to consider. Geriatric Psychiatric Consultations A795. This code is used for geriatric patients that are 75 years or older with all the elements of service code A195. One of the important criteria for the consultation is that it lasts a minimum of 75 minutes. For patients with complex neurodevelopmental conditions, you can bill Neurodevelopmental Consultation A695. In order to bill this code, you must spend at least 90 minutes of direct contact with the patient and caregiver. There is a maximum of 1 per patient, per physician, every 5 years. When you conduct a consultative interview to disturb patients, you will use the following 4 codes. If the patient is less than 22 years old, you will use A197 to the parents or the patient's representative and A198 to the patient. If the patient is at least 65 years old, you will use A191 to the caregivers of a patient and A192 to the patient. Note that you can also use A191 and A192 to a patient less than 65 years old with a diagnosis of dementia. Please be aware that these codes cannot be billed with a family psychiatric care or family psychotherapy for the same patient on the same day. But these codes may be billed with consultations if you have spent time with the patient as well. For example, you conduct a consultative interview with a caregiver of a patient who is 68 years old. You can bill A191A to the patient. Their some outpatient and inpatient follow-up codes can be found in section A116 of the OHIP Schedule of Benefit. For example, you rendered a 47-minute psychiatric care in an inpatient unit. You will bill 2 units of K199 to the patient. Please ensure the facility and the admission state are selected. If the service is rendered in the outpatient unit, you will bill K198 and choose No Facility, Outpatient Clinic for the facility. Please refer to the Schedule of Benefits section GP41 for calculating the time units and the minimum time required in direct contact with the patient or patient's representative. There are 2 forms which will be used frequently. Form 1, K623, is application for psychiatric assessments that include necessary history, examination, notification of the patient, family and relevant authorities, and completion of form in accordance with the Mental Health Act. Form 3, K624, is certification of involuntary admission that includes necessary history, examination, notification of the patient, family and relevant authorities, and completion of form in accordance with the Mental Health Act. K629 is all other recertification of involuntary admission, including completion of appropriate forms. Please refer to the OHIP Schedule of Benefits section A115 for more details. If you had to travel to the hospital to see an inpatient or a patient in the emergency department for a new consultation, then you can bill Consultation in Association with Special Visit Premium A895 and add the appropriate special visit premium. For the special visit code, you will need to use the one with the C prefix for inpatients, K for an emergency, and W for long-term care patient. Please review the Schedule of Benefits starting from section GP48 for the appropriate premiums for the times of the visits. For example, you need to travel to the hospital to see an inpatient on a weeknight. you can bill A895 Consultation with Special Visit Premiums, C962 Travel Premium for Inpatients, and C994 Visit Person Seen Premium for Inpatients. After seeing the previous patient, any subsequent patients, you can bill A895 and C995 Additional Person Seen Premium for Inpatients. When you need to spend additional time to see a patient on the same day, you're eligible to bill Consultation Extensions K630A. This code is based on time units of half an hour each for a maximum of 6 units per patient per day. The extensions can be added to any consultation if it goes over the time limit described on the Schedule of Benefits, section A112. Keep in mind that the visits don't have to be consecutive. As an example, if you see a patient in the morning and the same patient later in the afternoon, you can add to the consultation extension K630 and the number of units representing the time spent. There are 3 premiums which are specific to psychiatric codes. 2 are percentage-based premiums and the other is a flat fee. The acute post-discharge community psychiatric premium K187 can be used during the 4-week period immediately after discharge for a patient's psychiatric treatment. The high-risk community psychiatric care premium K188 is for service that occurs during the 6-month period following a suicide attempt. If both K187 and K188 are applicable, both can be billed within the same claim, and the applicable parent premium box will need to be chosen. Urgent community psychiatric follow-up premium K189 can be used if you're seeing the patient urgently during the 4-week period immediately after discharge for psychiatric treatment, and continue appropriate care of the outpatient for a minimum of 6 months. To properly bill these premiums, you need to document the patient's discharge and/or suicide attempt date. We have implemented a feature to assist you in tracking these dates and notify you if you may be applicable for premiums according to the rules from the OHIP Schedule of Benefits. Thank you for watching this tutorial. If you need further help, feel free to contact our support team, or you can always upgrade to the full service plan. Whatever your needs are for billing, we're here to help you save time and earn more.